الأنبياء والمرسلين نبينا محمد وعلى آله وصحبه أجمعين. I am Yasser third year student. My presentation today about maldistribution of healthcare services. And when we talk about maldistribution, that means there is effect or problems or wrong things affecting the community. When we talk about maldistribution, I will talk about the factors that affect the community, and then we will talk about the possible solution presented by Abdulhaleem after my seminar. Before starting my presentation, special thanks to my supervisor, Dr. Abdulhaleem, Hameed. Let's start with the objectives. At the end of the seminar, participants should be, inshallah, able to define access to healthcare, mention components of the healthcare access, and last thing, discuss factors affecting the maldistribution of healthcare services. Every system has goals, and the goals of the healthcare system is to improving the quality and reducing the cost, and then expand the access as possible as they can. Why this topic, or why this seminar? I have been asked by some of my colleagues, of my classmates, why Yasser you choose this difficult seminar or difficult topic. They said, yes, you can choose easy topic and you can prepare easy seminar and you can get the marks. But my answer was, if you're interested in something, you can present it well, inshallah. When we talk about maldistribution, that means there is poor access to the health care. What about small children in rural area? What about the areas that cannot access to the healthcare services? What about the elderly people? They cannot reach, or they have to transport long distance to reach the health care services. In this seminar, we can compare with the urban and the rural area. For example, in rural area, there are more poor access to the health care services, even in the urban areas. So my message today, health care for all. This slide, just to remind you the components of my presentation. We can start with the definitions. Definition of access to the health care. Access is always defined as access, service, and access service to the provider and institution. Those defined as the opportunity or the ease to which consumers or communities are able to use appropriate services in proportion to their needs. Social determinants of the health, this refers to the political situation that affect the health, individual, communities, and population. When we talk about community, we will talk about equality and equity. Equity, the target of the equity, or the target of the communities, or the services in the communities, is equity. Can be achieved by equal access for people in equal need, equal treatment for people in equal needs, and then good treatment outcome for all people in this community. Health, equality, and equity. When we talk about equality, you can give every individual in this community the equal amount of services. But some people they don't need these services. And some people they need the double services. So to achieve the equity, we can give every individual in this community as the need. Let's talk about components. The component of the healthcare accessibility and affordability, accommodation and availability. When we talk about access to the healthcare, that means the relationship between location of the patient and the services. Availability, the relation between the patient need and volume of services. Example, inability to find primary care, physician accepting patient for many reasons. Affordability, for example, for areas they cannot afford money to the services, so we can define it as the relation between the price and the ability to pay. And the last thing, accessibility and accommodation. For example, for the accessibility, the language between the physician and the patient. Accommodation, the example of the weekend appointments. And now we will talk about the factors affecting the maldistribution of healthcare services. There are many factors: financial factors, geographical factors, and workforce factors. We start with the income. The mode of the employment and payment for the physician is the frame of their option for the location choices. Even if the board areas provide more income for the physician and the doctors, there is a lack of the services. For example, the place to work and to live. It is very important for the physician and the doctors to live in the big cities, in their opinion, for the many services like airports and like big schools for their children and many factors. The work condition. As I said, even if the salary in the rural area from the doctors is higher than in the urban areas, there is a factor for the condition. It is better for the doctor to work in the easy condition rather than the difficult condition in the rural areas. Even prestige. Even prestige plays a role as more prestigious specialists tend to be concentrated in the urban areas, and we default to making rural practice less attractive. Location of medical schools. The fact said, doctors who are from rural regions are much more likely to go and practice in rural settings compared with those with urban upbringing. Even if you are from rural areas and you are studying in the urban cities, in big universities, most of the students will forget about the rural areas because they have lived in the big cities and they like living in the big cities. Healthcare workers shortage, and this is a very important role because it increased workload and too many patients per the doctor, resulting in the overworked and sleep deprived doctors. And this will affect the patient safety. I have finished my presentation and all this, the component of it, and here my references, and thank you.
Any comments?